Well, hey there, caregivers. I hope you are having a great day today. My name is Laura Wilkerson. I'm a nurse practitioner, and I have helped hundreds of families just like yours navigate the complexities of dementia and dementia caregiving. So, I was sitting at my desk today and I was looking over some reports. And for those of you who don't know me, I have a house call practice where I see geriatric shut-in patients, those with dementia and those with chronic conditions in the comfort of their own home. So today, excuse me, I was going over some chart notes and some visit notes, and I was looking at a particular patient who their family was having trouble controlling their behaviors. They had been with a previous physician. They had seen Genesight. They had seen a psychologist, a psychiatrist, kind of went the gamut to try to get their person with dementia's behaviors under control. And so I was looking to lean in and help this family out. Dad gets aggressive without notice. He will start swinging and become combative. And looks like he might have Lewy dementia, but of course there's no firm diagnosis there. Also has a history of alcohol abuse, so there could be some potential Wernicke's there. But anyway, the family is struggling with behaviors. And it looks like there had been multiple medications that they've tried. Some look like they've made the behavior worse. Some look like they might have dulled the behavior for a minute, but then the behavior came back with a vengeance. So if you're a caregiver who is struggling with dementia behaviors, not, of course, everything needs a medication. But if your person is at risk of harm, self-harm, or harming you, or if they're in an assisted living facility and they may harm somebody else, and multiple medications have been tried and corrective actions have been tried, then I think I've got something for you. So as I was reviewing this case, I realized that I was holding on to a secret that I should probably tell you about so that you can talk about with your PCP, and it's called Genesight testing. Now, what is that? Well, Genesight testing is a pharmacogenomic, that's a hard word, but it's a pharmacogenomic test that we can use as healthcare providers that help us determine how your genes affect medication outcomes. This test provides insight for those of us who have tried multiple things, they didn't work, a person's behaviors became worse, or they became dull in affect, or they were sleeping too much. This test can help us determine what might work best for you. And it's a relatively simple test. So I have everything here to show you, but because of my green screen, it's going to come out a little bit funny. But anyway, so you have these mouth swabs. And what you would do, this can be an at-home test, or your doctor can do it inside of their office. But there are two Q-tips, really super long Q-tips. And you take your person to the office, or you do this in home, and you take one of the Q-tips and you rub it on one side of the mouth. And there's an envelope, but I don't want to contaminate that envelope. So I'm just going to put this in here because I'm not doing a Genesight test on myself. Then you take the other Q-tip and you swab the other side of the mouth, and you put those in the envelope that your PCP's office has filled out for you, and you drop those in a FedEx box. But anyway, what this is going to do are there are two types of genes that this will test once you send it off. So once it's received by Genesight, they take it and they put it in their lab, and they look at two things: the pharmacodynamics, which is what your person's body does with a medication, meaning they ingest it and what happens inside of their body, and then the pharmacokinetic side, which is how does their body break medications down. So if I decide to prescribe risperidone for somebody who's having hallucinations and bad hallucinations that scare them and frighten them, and I use risperidone. Well, how does that risperidone work in their body? How does their body work with it, because their genetics are unique? And then how does their body break it down? Because those are all important things to know, because as we age, our bodies handle medications differently than they did when we were younger. So this goes off to a lab. You're at home, you're waiting, we're trying things, behaviors are getting worse. But then what happens is, and I hope you guys can see this, but your doctor's office, your PCP, will get something that looks like this. And it has antidepressants, anxiolytics and hypnotics, antipsychotics. And what this does is it provides your, gosh, I hope it's coming out clear. The green one isn't because I have a green screen background. But anyway, it gives us a go, whoa, and no list. So what this does is it tells us, okay, these medications in this list are going to work really well with your person. Your person's body is going to break these medications down and utilize them in the manner that they should. Oh geez, I'm really sorry here. In this, I'll turn it this way. In this particular list, these are medications that you could potentially use, but they may or may not work in your person. And in the red list, don't use these medications because they're not going to work in your person. And the cool thing about this report is that, you know, most geriatric patients are on 5, or geriatric people, patients to me, geriatric people are taking 5 or more medications. And in order to see what medications work well with each other or against each other, having something like Genesight testing at our fingertips makes it a lot easier than playing a guessing game. Because how frustrating is it for you as a caregiver when you're being prescribed multiple medications, not knowing how they're going to work with your person or with your person's genetic makeup? So if you've tried lots of things, or your PCP has given you lots of prescriptions for things, and you feel like you're throwing a lot of money down to fill prescriptions to only find out that they're not working for your person, or that they actually made the behaviors worse, because people can have adverse reactions to medications. If you are finding that, you might want to bring up the topic of Genesight with your primary care for your person. And they may or may not know about it. But I think by bringing it up to them and saying, hey, I heard about this test called Genesight. It's relatively simple. It's 2 mouth swabs, each cheek, putting it in an envelope and sending it off. You can do the following things. Number 1, you can get a personalized medication plan in place. I think that just prescribing what works for one person is going to work for the next. We all know that doesn't work, because there is no one size fits all with dementia care. So you will get a personalized medication selection or plan for your person when you get this test. And again, it has lots of medications in here: mood stabilizers, antipsychotics, stimulants. So there's great information in this. And then it breaks down your person. And it tells us how different drugs are affected in your person's body. But anyway, you can reduce risk of adverse reactions. I think the statistics say 1 in 10 hospitalized geriatric patients goes into the hospital for an adverse medication reaction, because we're going to start something based on symptoms, and we're treating those symptoms, but we're not 100% sure how your body is going to react. So we educate you as you leave the office by saying, okay, if you see any of these signs or symptoms, then stop this medication immediately. Well, you've already paid for that prescription. You've already done the things that you need to do to have that prescription in hand. So now you're like, okay, now what do I do? Well, by taking the Genesight test, you can reduce those risks of adverse reaction. You can optimize treatment options, because if you have all of this information in your hands and you go in to discuss it with your doctor, you are presented all of the medications and what really works best with your person and their genetic makeup. For you as a caregiver, the Genesight test provides great information that narrows down that medication selection and has better potential outcomes for you as a caregiver. You're not trying 5 or 6 different things. You're not paying 6 or 7 different things. And it gives you, this test gives you the knowledge and power to advocate for your person for a personalized care plan with your PCP to better support your person with dementia. For us as caregivers, care providers from the medical side of things, it helps us with enhanced decision making. By incorporating a Genesight test when you've tried other things, it allows us to look and make a more informed choice. Again, can we do trial and error? Yes, 100%. We can do trial and error, but is that the best thing for your person with dementia? I would think not. I think by doing a test like this, getting the results, or submitting the test, getting the results, and then bringing you back in to go over what might be best for you with your person based on what medication choice, talking about what that medication will do for your person and what you can expect to not see and see. Because with every medication that you take, obviously there are some side effects that you want and there are other ones that you don't want. So if this makes your person sleepy and you are caring from a distance or you're still working, you might not want them wandering around the house sedated. But having this information in your hands empowers you to make better choices for your person. And again, super simple. 2 swabs, each cheek, put it in an envelope, send it off, and about 2 days later, your primary care provider has those test results. So I think, like I said, there's not a one-size-fits-all approach to treating behaviors. There's not a one-size-fits-all approach to caring for somebody with dementia. But the more we know, the better we can advocate. And the better we can advocate for caregivers and giving them the knowledge that they need, you can go into your doctor's office and say, hey, I heard about this great thing called Genesight. It sounds like it can streamline the medication choices, the process, reducing the need for trial and error, and optimizing those outcomes for my person that I'm caring for with dementia. Can we do this test? If your PCP says no, well, then you either go to a new PCP or they'll refer you to somebody who can do this test. If you have ever heard of this test and you've taken it and you're willing to share in the comments below, how did it work out for you? I'm telling you that for me as a primary care provider, this test has worked great. It's given us great insight. As far as insurance, most generally, from what I remember, I try to stay out of people's insurance information and that part of it and just take care of the medicine needs and the caregiver needs. But from what I understand, Medicare covers pretty much all of this, and you would have a copay just like anything else. But you can always call the number on the back of your insurance card or your loved one's insurance card and ask them, is Genesight something that is a covered benefit for me or my person with dementia? If you have any questions, any experience with Genesight yourself, drop them in the comments below. I think this is a great test. I think it's something that you should know about. I think it's something that you should advocate for your PCP to use in your person with dementia if you've been struggling to get certain behaviors or certain things under control. Again, it does a lot of different medications. If your person's having trouble sleeping, it's going to allow your PCP to see what would work best for them so that you both get a good night's sleep, because you can't take care of your person unless you're taking care of your own sleep needs first. Again, drop your comments in the section below, and I will be back next week to talk to you about something very exciting that I have for caregivers to use on how to communicate better with your PCP when you have a concern about your loved one with dementia. As always, take care of yourself, take care of your person, and we'll see you next week.